Palliative care is an essential component of modern healthcare that focuses on improving the quality of life of patients and their families who are facing the life-limiting serious illnesses. Nurses' objectives of palliative care are relieve suffering, enhance quality of life, effective communication, holistic care, pain management, advanced care planning, family support, care coordination, psychological support, education, respect patient wishes, end of life care. Definition of palliative care is a holistic approach to care that aims to prevent and relieve suffering. It addresses not only physical pain but also psychological, social, and spiritual distress. It can be provided at any stage of illnesses and alongside curative treatment. Palliative care is needed for patients with chronic or life-threatening conditions such as cancer, advanced heart diseases, chronic kidney diseases, neurological disorders, and end-stage respiratory diseases. It is not limited to end-of-life care. There are 4 domains to assess about palliative patient: physical domain, social domain, psychological domain, and spiritual domain. Goal of palliative care are to relieve pain and other distress symptoms, enhance comfort, support patient and families emotionally, and promote dignity and quality of life throughout the illness journey. Principles of palliative care are: face life and regarding dying as normal process, intend neither to hasten or postpone death, provide relief from pain and other disease symptoms, integrate the psychological and spiritual aspect of care, offers a supportive system to help patient live as actively as possible until death, offers a supportive system to help patients' families cope during the patient illnesses and in their own bereavement. Palliative care can be given at hospital, hospice, community, and home. End of life care. End of life care include physical, emotional, social, and spiritual support for the patient and their families. Goal of to control pain and the other symptoms like nausea, vomiting, dyspnea, delirium, so the patient can be comfortable as possible. May include palliative care, supportive care, and hospice care. Involve range of possible decisions including patients' right to choice, participation in clinical trials, and choice of medical interventions. Continuous of routine medical interventions. Hospice care. Hospice is a comfort care without curative intent. The patient no longer has curative options or has chosen not to pursue treatment because the side effects outweigh the benefits. Now we look for small video. What is palliative care and what is hospice care?
Palliative care and hospice care. What is the difference? Palliative care and hospice care are 2 types of care for people with a serious illness. But what's the difference between the 2 types of care? And how do you know which one is right for you or your loved one? Let's start with palliative care. Palliative care is specialized medical care for anyone living with a serious illness, such as cancer or dementia. Patients in palliative care can receive medical care for their symptoms, along with treatment that is meant to slow or stop their illness. The main goal is to improve a person's quality of life. The palliative care team works to prevent or ease suffering and help patients and their families make difficult healthcare decisions. Palliative care can be delivered in a hospital, nursing home, palliative care facility, or at your home. Hospice care is a type of care for people with serious illnesses who cannot or choose not to continue their treatment to cure or control their illness. While palliative care may occur at any time during a serious illness, hospice care typically occurs when a person has 6 months or less to live. Hospice care is similar to palliative care in that it aims to help improve a person's quality of life. It also helps family members cope with their loved one's illness and death. Depending on symptoms and end-of-life care wishes, hospice care may include services such as emotional support and spiritual support for the person and their family. Hospice care could also include relief of symptoms and pain and help with advanced care planning. Depending on the situation, it can be provided in the hospital, at home, or in a facility such as a nursing home. To learn more about palliative care and hospice care, visit www.nia.nih.gov/palliative-hospice.
Palliative care is delivered by a multidisciplinary team that includes doctors, nurses, social workers, psychologists, and spiritual care providers. Nurses play a large role in assessing symptoms, providing comfort, and support to families. This is the scenario. A 40 years old female patient diagnosed stage 4 left side breast cancer with liver and bone metastasis. She's done left side mastectomy a few months ago, completed all cycles of chemotherapy, currently receiving radiotherapy in the cancer ward. Ongoing wound dressing is being performed regularly on the mastectomy site due to the delayed healing. The patient's husband passed away a few years ago. She has two children, 10 years old and 5 years old daughter. She is complaining of pain, fatigue, body weakness, fear of death, hopelessness, and long line feeling. The physical aspects. Goals: relieve symptoms, promote comfort and maintain quality of life. Nursing intervention, pain management, assist pain regularly. Wound care, continue regular wound dressing, prevent infection and reduce odor. Fatigue management, encourage rest, period of life actively as tolerant. Nutrition and hydration. Symptom management, manage nausea, constipation of breathlessness as needed. Monitor side effects of radiotherapy. Reduce emotional distress. Nursing intervention, emotional support. Encourage the patient to express fear, sadness, and worries. Provide active listening. Counseling referrals. Children's emotional needs. Identify emotional impact of children and refer to social service. Social aspects. Nursing intervention is family support, engage grandmother in care discussion to strengthen understanding and caregiving capacity, community and social resources, link the family with the social worker, palliative care society, financial and material assistance, arrange home-based care visit if available. Spiritual aspect of nursing intervention, spiritual assessment, explore patient belief, values, and faith traditions. Support spiritual needed. Facilitate visit from religious leaders or cleric if she wishes. Nurses are central of palliative care. They provide continuous care, manage symptoms, communicate with patient and families. They advocate for the patient comfort, dignity, and preferences. Effective communication is critical in palliative care. Healthcare providers must listen empathetically, provide honest information, and support shared decision making between patient, family, and care team. Palliative care respecting patient autonomy, cultural available, and spiritual belief. Ethical principles such as patient dignity guide all palliative care decisions. Benefits of palliative care: improve symptoms control, enhance patient satisfaction, reduce unnecessary hospital admissions, and supports families during difficult times. It leads to better overall healthcare outcomes. In nursing practice, integrating palliative care principles help ensure compassionate, holistic, and patient-centered care. Early referral to palliative care improve quality of life for the patient. Palliative care is not about giving up hope, but about improving comfort, dignity, and quality of life. As future healthcare professionals, understanding and applying palliative care principles is essential for compassionate nursing practices. Thank you.